I've got great news for people that are frustrated with having a low heart rate variability despite having really good cardio aerobic fitness. So we'll break it down in today's article, Cardiac Vagus and Exercise. Heart rate variability is a frequently used measurement to determine how healthy someone's autonomic nervous system is, specifically of the vagus nerve or the parasympathetic nervous system. People like HRV for a few reasons. First, it's easy to obtain and cheap. Second, it's widely acknowledged to be a good surrogate measurement for vagus nerve function. And third, there's lots of data that suggests that improved HRV is associated with positive health outcomes and poor HRV is associated with worse outcomes, so it tends to be a good predictive measure of someone's health, performance, and recovery. But there are some frustrations with HRV, mainly the idea that for some patients, HRV just isn't that modifiable, even if you're doing really good things in terms of your fitness and doing things that are widely to be seen as relaxing and parasympathetic. I was listening to a recent episode of Peter Attia's podcast where he talks about heart rate recovery and how that could also be used as a measure of vagus nerve function, and it's something that a lot of fitness-centric individuals can tend to use, especially those in track and endurance type of sports. Heart rate recovery is basically the measurement when someone does maximal or near maximal levels of exercise, where their heart rate is pretty spiked, and then the 1 to 2 minutes after they have stopped exercising, you can see how much does the heart rate start to come down again. There are different standards for heart rate recovery, but the most common measurement is taken when someone does a near maximal level of exercise intensity, spiking their heart rate, and after they've stopped exercising in that 1 minute period after they've stopped, what is their heart rate? And it should start to come down depending on someone's level of cardio aerobic fitness. In someone with good levels of vagal modulation, as they increase their exercise intensity, you'll see that their heart rate will come up. When they've stopped exercising, you'll see a nice strong downward slope of their heart rate, and that indicates that the vagus nerve is starting to pull the heart rate back down pretty aggressively. On the red bar, you can see that as someone's heart rate starts to go up, even in the moments where they stopped exercising, that decrease in heart rate is actually much flatter. So what does normal look like? In the patient done on people that are otherwise healthy but varied levels of cardio aerobic fitness, a low fitness group will have a heart rate decrease of about 18 beats per minute after a submaximal exercise test. A moderate fitness level will have about a 26 beat per minute decrease in heart rate after 1 minute, and people that have high levels of fitness, meaning a VO2 max of 48 or above, have a 32 beat per minute drop after 1 minute.